Hello and welcome back to Postpartum Wellness Initiative's chats with perinatal professionals for Maternal Mental Health Month. Today I have Cindy McMillan, LCSW, join me. Cindy is a licensed clinical social worker working with infants and their caregivers, children and families out of her private practice in Cherry Hill, New Jersey. She graduated with her MSW from Temple University and is currently working towards specialized training for her Register Play Therapy certificate and an endorsement for the Alliance for Advancement in Infant Mental Health. Cindy has been working with vulnerable populations for the past 16 years. She began her career working just with adults. Cindy's clinical work led her to providing therapeutic services for children and finding a special interest in infancy and early childhood experiences. She has worked with children who have experienced a variety of behavioral and mental health needs, coping with grief, divorce, adoption, and family disruptions. Cindy works with young children and caregivers, providing support in building attachment and healing relationships.
So thank you again for hopping on with me, Cindy, to be able to just, have this. Can you explain to me a little bit some of the major aspects of early life that kind of impacted infants' mental health? It's so funny because I think, people don't think about mental health when you think of an infant. You're like, oh, they have all these physical needs, so they can't, what could possibly be going on? But it's so not, it's so not true, right?
Yeah, infants develop in relationships. And so kind of infant mental health in general, I'm like, just to define it for people, is 0 to 3, which is an organization. They provide support for parents and professionals. They do research. They put a lot of great information out. They define infant mental health as the capacity for infants and toddlers to experience, regulate, and express emotions, form close and secure interpersonal relationships, and explore their environment and learn. So basically, infants are emotional beings, right? They have an emotional world. They develop emotionally, and they have these emotional needs that must be met. So when we talk with parents a lot of the times about what contributes to concerns with mental health, right? What are the risk factors? There are a lot of risk factors. Prenatal care, infants who are born preterm, infants with depressed mothers or caregivers with any mental health concerns, infants that are raised in institutions, so may have been adopted later in life too, infants that have parents with substance abuse concerns or domestic violence, obviously abuse and neglect that occurs. So we're really looking at, and if you've heard of ACEs, the adverse childhood experiences have. So all of those ACEs, right, they contribute to risk factors. And although we're going to kind of focus on maternal mental health related to infant mental health, that's one risk factor. And so there is a cumulative effect where, one risk factor doesn't necessarily mean that an infant's going to suffer relationship concerns or emotional concerns. It is one aspect of that. And so I think sometimes we have a lot of pressure as parents nowadays, and it could be very, very, like we feel that pressure. We feel the guilt related to that. And just keep in mind that that's just one aspect of it.
Right, absolutely. I feel like that is such an important point. I'm sure you probably do this all the time with your clients, with the parents that you work with, that, and because I know I do too, mentioning to parents that, your own mental health or your own things going on in your life that the baby's kind of around is just one piece, and there's no, the guilt. I mean, mom guilt is real, right? A parent guilt is so real. Like, we feel it no matter what. That's what it's like. If you're depressed, you're going to probably feel guilty no matter what way you do things. But at the same time, feeling guilty about how you feel, which you probably have no control over. There's many things that we don't have control over in our own lives. It's not going to change anything. And there's lots of things that you can change and you do have control over, or that you can change over time. Like going to therapy, and things like that. So I think, all these different aspects contributing, there's different pieces in a puzzle, and there's not one deciding factor, which is so hard, because I think a lot of the conversations that parents have, about their infants are so black and white. Are you breastfeeding or are you formula feeding? Are you this or are you that?
Keep in mind that because you have risk factors maybe in your life, or your infant has risk factors in their life, right? It doesn't necessarily mean it's leading to problematic behavior or concerns when you have these protective factors and strengths that protect you from all of these risk factors. So that's a huge piece of infant mental health too, is looking from a strength-based perspective at being able to see, like, okay, these are the things that are really going well, that you're really helping your infant with. And maybe here's the area we're going to focus on with developing.
Yeah. And what are some of those strengths that you usually end up either pointing out, or some of like the major, those like kind of resiliency factors that you kind of see that you often are pointing out to parents?
So other family members' involvement that are supportive, right? Because that could go either way, right? But other families that are members that are supportive, able to come in and help, being able to provide stability to your infant and have a somewhat routine, because let's be honest, infants aren't on a routine. They do their own thing, which is probably part of the stress of being a parent, right? Is working within this lack of routine. Also, like some of the things we'll talk about later on of interventions, but some parents do really well with, like, being able to respond to their infants' concerns and needs. Being able to understand how they're feeling, right? Infants are hard to understand at times, and we'll kind of talk about that a little more too.
Awesome. That's super helpful, and I hope that's helpful for anybody that's listening that's thinking that, they don't have any strengths, or because something bad happened to them that they, that their baby's gonna, I don't know, have a bad time or whatever.
Right. Yeah. Now I hear a lot, like, I've ruined my baby, or like I've made it so hard for my infant, right? Like, and it's just one piece of it. And I really, do want to emphasize, like, because of the pressure we have, right, that we often hyper focus on things that maybe not as big as we're seeing them.
And sometimes it takes therapy to be able to see that too. I feel like that's part of, why you're in it, is to be able to kind of broaden your perspective a little bit. We all need that, especially as parents. Do you see a, like a common thread among your families that you work with that might be seeking this type of therapy? Like either, like, I know we kind of briefly touched on it, but like different situations, like just, if there's something that, if someone's listening, they might be like, oh, this might be a good thing for me. What might some of those families what are those families that you typically see?
Yeah, so typically when parents are coming to me, because I'm a therapist and because I'm specializing in infant mental health, there's usually something that has happened. So it's usually a trauma that has happened, maybe domestic violence, typically like an event that has occurred that is out of the normal, and they come to me and are concerned about things. So that's one aspect I get clients in. What I would love to see is that we're providing more education about maternal mental health and infant mental health together. Caregiver, not always the mother, but the caregiver affects the infant and the infant affects the mother, right? And so infants and caregivers are so intertwined and so sensitive to each other's needs. And an infant can be aware of emotional signals from their caregivers, and that could happen through their tone of voice, gestures, any movements and facial expressions. So they're little sponges picking up on this information right away. And they're going to thrive in a safe and secure relationship, and so do the parent. So if we have a parent who is having trouble connecting, who is having trouble attaching to their infant. There are interventions we can use with that and help them rather than them feeling like they're out on an island alone by themselves, because the caregiver, the mother, typically needs to provide this safe, secure, seen, heard relationship to their infant, but they can't do that if they're not feeling safe, if they're not feeling secure or seen or heard. And so it is really this two-way street of receiving what they need in order to give what their infant.
Mm-hmm. And I think that, that goes back once again to that kind of, I'm giving everything that I can to my kids, so how I feel doesn't matter, or it's me, being selfish, taking care of my own mental health. It's so not true. And that's exactly the point that, we try to make to parents all the time. And that's why we're even having this conversation or talking about all these things, is because it is important to your child. They are sponges and they are affected by your, not entirely, like I said, we just talked about how things aren't black and white, but at the same time, it is an important factor in your infant's development, is how you're feeling, because they, like I said, there's, little sponges, they pick up on everything. They pick up on everything. So it is important. It's a part of your baby's development to make sure that you're doing okay.
Absolutely. And I think that is what motivates most mothers or caregivers to go get the help, is because if they're realizing that, oh, my infant is going to be affected by this,
Mm-hmm.
rather than I'm just going to suffer by myself and give my baby what they need.
Mm-hmm.
Because your baby is so sensitive to what's going on in their environment, especially with their primary caregiver, getting yourself the help you need is really helping your infant and that relationship grow.
Mm-hmm. Absolutely. And hopefully that's a ray of hope for many clients and many parents out there, even like you said, like primary caregivers, where there is help out there. There's things that you can do, and it's cumulative. So if you hadn't been doing so hot at first, like you've got plenty of time to make a difference, whether it's been a couple weeks or even a couple months or something like that, for sure. So important to mention. So what are some of the things, if somebody is, kind of hearing this and thinking like, maybe this is something that I'm interested in, like if someone's, interested, what are they going to be doing in, sessions with you?
Yeah, so infant mental health really is just focused on that relationship.
Mm-hmm.
So it's going to be a little different than the mother who might be depressed and just going to see her own therapist. They're going to provide a different piece and intervention than an infant mental health professional who is going to look at that relationship.
Mm-hmm.
And so really being able to look at how the parents may be identifying and interpreting their own relationship reenactments. The goal is to have children and then adult teens and then adults who can regulate, right?
Yeah.
But as an infant, you can't regulate. They need the caregiver to provide that calm attention and soothing, loving touch, and in order to internalize that regulation. So it's kind of like, I always give my parents an example that it's kind of like the thermostat. I walked into my office this morning and it was absolutely freezing in here. And so instead of like trying to figure out a way to heat up just this room, independent of everything else, I had to go to the thermostat and turn the thermostat on. And that's going to regulate my temperature throughout my whole house. And if the baby is this room, right, I know I have to be the thermostat for them. I need to be able to regulate their temperature, quote unquote temperature, right? Their emotional temperature. And in order for them to internalize it and eventually be able to do that alone as they develop. So we do this through incorporating games and toys and touch and play. And something as simple as a game of peekaboo, right, with your infant. That's going to help them build their sense of what is to be expected, of what feels right in the world, as well as skills like social turn taking and reciprocity and cooperation. So all that in a little game of peekaboo, right? So those are some of the things we will also navigate ruptures and repairs. So I think this is a good time to maybe talk about the good enough parent. Have you ever heard this term, the good enough parent?
A couple of times. Yeah. Yep. Yep.
Yeah, so Winnicott, who did research in the 50s, coined this term, the good enough parent. And basically what came out of all of his research was that we need to be in tune with a child and meeting a child's needs 30% of the time. 30% of the time, right? I can guarantee many parents out there who feel like they aren't doing that are meeting their needs.
Are totally doing a good job. Yeah.
And that'll help develop a secure relationship with your child.
Also, the 30% thing is crazy because I feel like that is such a good perspective of like, if you have to, for example, going back to kind of like the co-regulation thing too, like if you have to put your baby down and let them cry in their crib for 5 minutes while you step on your porch, they're fine. Because you can guarantee 30% of the time you are attending to their needs, and you have to watch your own thermostat, or you have to be able to, you have to be calm. So if you got to, go step out, or sometimes I'll even tell parents when I'm talking to them, one thing, if, when you're waking up with your infant and you feel that sense of like that irritation or rage or whatever, when you wake up, it's 3 a.m, do something simple like loop to your sink and sit there with a glass of water before you go in, just to kind of like, be like, all right, I'm here, and then go in, versus having to rush in. Baby will be fine. They'll be mad for however many minutes till you get, but they're going to be okay. Like, yeah.
I'm glad you said that, Kelly. There is a lot of shame around this. I think there's also a lot of controversy around it just in general, and you're going to get lots of different opinions. But yes, you need to meet your needs. And we're not saying leave the baby for 30 minutes or an hour, right?
Exactly.
Screaming and crying. But if you need 5, 10, even 15 minutes to collect yourself, you can do that. Your baby, you will be able to repair that with your baby. You will be able to then engage more easily with your baby if you feel regulated and calm and ready to deal with that.
Yeah. Yep, exactly. And what are some of the other barriers that you see with your clients, or that they talk about in this work?
Yeah, I think some things I see are like these common misconceptions that come up, right? Like that is often a barrier, that parents might feel that babies don't have mental health. That's a huge misconception, right? Like I often hear like infant mental health. What is like, what are you doing there? What is that? And, being able to provide education around that is helpful. Or having this idea that babies are too young to remember things, right? There is lots of research now that show us through the polyvagal theory, right, that have come up that babies really internalize, and that's the kind of the building block of their development. So babies can remember. Other family members' opinions come up all the time. They think I'm holding him too much. They think I'm gonna spoil him, right? So oftentimes dealing with some of those comments. Also, it just takes time to change our repetitive behaviors, right? So we talked about like reenactments that we often go through as parents. And we get into this repetition and this behavior that just is constant, and it's hard to change that. And so it really takes time and effort to change these automatic responses we might have to the situation.
What are those goals that you're kind of trying to hit?
Yeah, so a lot of the things we talked about, but also it's those building the relationships. So like helping the caregiver understand and be sensitive to their responses to their infant, right? So how we are responding to their needs. Some other goals are supporting an infant's emotion. So oftentimes, right, we'll get parents who are like, well, they don't understand what I'm saying anyway, which, okay, like, yeah, part of them doesn't understand that language, right? But talking is going to help them develop their language. It's also your tone that's going to help them. And so when your infant's crying by saying, oh, you were so scared, that big truck outside, that noise scared you. They might not understand, those words. However, they can sense the tone, and you are responding to that emotion that they've had. Supporting their physical development, right? We talk often about supporting physical development, and some of these things seem minor and natural to some parents and are really difficult to others. So, when we sit our babies up, when they're learning to sit up, are we sitting them up and leaving them, or are we supporting them? Are we making sure that we're watching their physical development?
Right.
Being open to the child's interests and activities and their own agenda, which I know sometimes I get confusion around this with parents, because you're like, well, that's well and fine for a 2-year-old and a 3-year-old, but what about my 8-month-old, right?
Who just wants to eat the TV remote or something.
Right. And that's where becoming sensitive to their cues can help, right? Because they might show interest in something, and you can then engage them more in that interest, right? Oh, you see the rings, look at those rings. And then you're talking about the colors, or, something like that. We also work, some goals with some families is on promoting learning, and that's through their language experience. So just kind of what we're talking about, and being able to verbalize and talk to our infants, having reasonable expectations for our infants and our children. Like you said, that infant that wants to put something right in their mouth, right? Like, is it reasonable for us to pull it out all the time? Maybe not, right? Is it reasonable and important for us to ensure it's safe for them? Yeah.
Right.
And so having these reasonable expectations based off of their developmental stage. Being able to adapt your strategies to where your child's at is important. So sometimes we get stuck on, well, they're this old and they should be doing that.
What are some of your favorite things that you've either seen, or that you're kind of at the end of the day like, yeah, this is why I did this?
I love watching the relationship develop between the infant and the caregiver. It is so rewarding and so amazing to see how that changes the infant, how that changes the parent, right? Like like we said, it's a two-way street. Being able to delight in each other, something that has been hard, that they like the relationship together that they finally get, right? I love seeing those moments, and just the idea that, and this is so idealistic, but that we are creating this better world for these children, right? Like that we're changing the trajectory of some of these children's lives. And that's so important in their world, in our world as a whole, to be able to support.
Well, and that's, I think that that's a lot of hope for parents too. I don't think it's necessarily just like, this lofty kind of a thing, but at the same time, it's like, I mean, like you said, the past is the past, or things that have happened to you have happened, but look at all this hope that you can have, and look at all these things you can do. And you can make these choices, and you can go about your day a little differently and do a little bit of work on yourself and, for your baby, and you can both feel better. Who doesn't want that? That's awesome. That's awesome.
Yeah. And so, I mean, it is a very rewarding job, and it's hard at times, right? Because you're getting these caregivers and infants. And sometimes we talk about matching a lot in infant mental health. And sometimes there's just difficult matches, right? And that is hard to see, and it's hard to watch. And there's so much hope for changing that and addressing that and being able to then develop this wonderful relationship with your infant.
That's awesome. Good to hear.
Yeah.
Well, thank you again for joining me on this chat. This has been so informative, and I think it's so interesting to talk about all these different things that maybe a parent will be hearing this and say, oh, this all sounds awesome, or it's okay that that I have things to work on, or there's things out there that I can do or that I can reach out to about for help. I think we'll definitely have some of the resources that you mentioned linked in with this chat so that people can go and do a little bit more of their own research and things. But thank you again, Cindy, for jumping on and answering all of these different questions. It was a really interesting talk that we just had.